Good afternoon, and welcome to the Beyond the Blueprint webinar series. This series was designed to empower health IT professionals with the latest insights and strategies for integrating digital tools seamlessly within your projects. Whether you're embarking on a hospital remodel, constructing a brand new facility, or undertaking a targeted renovation, technology is playing an increasing crucial role in shaping the future of healthcare delivery. In Beyond the Blueprint, we explore how to successfully integrate leading-edge technologies and processes to enhance patient care, optimize operational efficiency, and to drive a positive and compelling ROI. My name is Greg Malkery. I'm the Managing Director at Spyglass Consulting. I'm also the host for this series. Joining us today is our guest speaker, Dr. Howard Landa. Dr. Landa is currently the Chief Medical Informatics Officer at Adventist Health, headquartered in Roseville, California. He's also the president of the Association of Medical Directors of Information Systems, also known as AMDIS. Howard, welcome to our webinar. Would you like to introduce yourself?
Thank you, Greg. As you said, I'm the CMIO for Adventist Health. We're a 26 hospital system in Northern California, throughout California, with one hospital in Hawaii and 3 up in Oregon, going through an expansion, requiring new hospitals even this week. I've been there for about 4 months. I've been in the CMIO role at various IDNs for about 25 years. I've worked at academic medical centers, health plans, private hospitals, as well as county facilities. My role at AMDIS, I've been the chair of AMDIS for the last 5 or 6 years, and I've been on the board of AMDIS since the late 90s. We are a group of medical informaticists and informatics leaders from around the country, a thought leadership support for medical informatics, and we put on several conferences a year, including partnering with HIMSS for their physician forum or physician symposium, as well as putting on our own meeting every year in Southern California. And it's a pleasure to be here. It'll be a fun discussion.
Great, thanks, Howard. Now, before we dive into today's discussion, I want to express my gratitude to our valued sponsors who've made this webinar series possible. We have Lars Anderson from Storage Systems, and we have Keith Washington from Simplify Medical. Lars and Keith, could each of you share a brief welcome and tell us why you're excited to be involved in this series?
Yeah, thanks, Greg. This is Lars Anderson, Director of Sales and Marketing here at Storage Systems Unlimited. And, why we like to be a part of this series is that we like to be involved, early on in the early stages of constructions or remodels or renovations, because a lot of what we sell, we're not going to sell too often. So we want to get in there early, things like shelving and cabinetry, but those things are becoming more and more technical. So we're having to consider technology to a much larger degree in all different types of facilities and projects, from the sterile processing room to endoscope storage and telehealth carts like those provided by our friends here at Simplify.
Yeah, and thanks, Greg. This is Keith Washington with Simplify Medical. So Simplify is a car-based mobile technology company headquartered in Chicago. We've been in the point of care technology business for about 20 years. We design and manufacture workstations for improving care at hospitals. And really excited about this webinar topic with digital health. It's such an important part of what we're working on every day. So just looking forward to hearing from Howard.
Great. Thanks, Keith. During today's webinar, we're going to explore the intersection of digital health, patient engagement, and the role of clinicians. More specifically, we're going to define digital patient engagement, activation, and empowerment. We're going to explore the evolution of digital engagement strategies, especially in a post-pandemic environment. We're going to analyze key operational challenges in deploying digital tools at scale, and we're going to identify emerging technologies and the impact on cost, quality, and outcomes. With that, let's kick things off. Howard, maybe we can start off, but maybe you can define for us what exactly is digital health and how does it relate to patient engagement, activation, and empowerment?
Yeah, I'd love to know too. I've been in this space for 25 years, and digital health is a relatively recent term. Um, the FDA said it was healthcare IT plus mobile health, wearable devices, telehealth and telemedicine, personalized medicine. And I've always considered all of that under the heading of HIT. So if we want to say that digital health is a rebranding of healthcare information technology, I don't like that because I've always found that, when you start rebranding things, you're usually doing it because of a bad outcome. You think Microsoft Vista going to Windows 7, Anderson Consulting going to Accenture, and my favorite, the Ford Pinto going to the Ford Focus. I don't, just rebranding it, I don't think helps. What I like to look at it as is digital patient engagement plus. So digital health to me is all of the technology we deliver as healthcare organizations and as technology in general to patients that also has an impact on the delivery mechanism. So when a patient is using an app, patient is looking at their patient portal, is communicating with their physician, that physician or other clinician is responding. To me, that's the digital health piece. And I think that really helps separate it from hardware, from basic EMRs, into something that really is changing the way we look at how we work with patients as healthcare organizations. Years ago, we started off when the web was young with just kind of customer engagement. You would be able to share with people what services your hospital provided, what specialties were there, what were your hours of operation, where was your emergency room, even how busy it was. And then we started moving to patient engagement when we started sharing information with patients. We provided them with their results. We provided them with information about their diseases, even presenting them with their lab results. And now with the 21st Century Cures Act, their actual full notes, the whole open notes paradigm. I think what we're moving towards now really, and I think the new technology is enabling this, is really patient empowerment, where we are working with our patients to improve their health. So I look at it as less of a paternalistic doctor to a patient, as a much more collaborative thing, where we're collaborating with patients. They have tools they can use. We can see the information that they can provide, and we can all work together to improve the health of individual patients or a population. Physicians have complained when patients come in with a stack of PubMed searches they found by Googling their disease. I think we're going to come to a time where people are going to come in with a treatment plan created by a digital app or even something like ChatGPT, where they put their information in and ask a series of questions and come up with something that physicians can actually interact with and that patients can understand and use. The difference between a physician telling a patient what to do versus a patient coming and asking, hey, can I do these things? It really flips the script. And I think it has a real potential for getting more engaged patients and getting them more involved with their care and actually following through, because behavioral management is the hardest thing that we have to do in medicine.
Excellent points. So what I'm really hearing, Howard, is that digital health is really just healthcare for the 21st century, and that we're finally catching up and we're being able to consumerize it in such a way where consumers and individuals are embracing these technologies in theory to take a more active role in managing their health, which I think is exactly where we need to be. Now, I live in Palo Alto area, but it'll be interesting when it starts to go to all areas across the country, regardless of demographics or socioeconomic levels.
Those are going to be real issues. The whole social determinants we'll talk about more, and that digital divide that is still very much present.
Howard, how have digital engagement strategies evolved since the pandemic, and how have these strategies influenced cost, quality, and healthcare outcomes?
Yeah, so during the pandemic, everyone was scared to go to the office. The patients, the doctors, the staff, nobody wanted to go there. So virtual care exploded. I mean, when I was at Sutter, we increased the number of virtual visits we did by orders of magnitude in weeks. And I think it's something patients have always wanted, and I think they really appreciated it. And one of the biggest barriers was the reimbursement model. And during the pandemic, that reimbursement model was really changed to make it possible. as we evolve from the pandemic, I think there's some patients who really like to be in the office. They want to be one-on-one with a physician. They like that physical touch, and I think that's something we have to offer. But I think for many diseases and many problems, the virtual is still a good way of delivering care. There are compromises, getting vital signs. You can't really do a physical exam. You can't provide medications. And if you need to do a lab test or a radiology test, that patient is still probably going to need to go somewhere, versus when they were in your office, you might be able to say, hey, on your way out, stop at the lab. So there are issues that we need to address there, but finding the right mechanism to take care of patients that works for the clinician and works for the patient is a real opportunity for us. Again, I think we still need to work through the billing and regulatory issues, but whether it's a patient requesting medical advice for something simple, an e-visit where you actually have more of a more regimented asynchronous visit, a virtual visit through telemedicine, in person in a hospital in acute care, or afterwards at hospital at home. I think they're all opportunities for us that we really need to explore. That one doctor, one exam room, one patient paradigm, we've said for years has to go away. I think we finally have an opportunity to actually start moving on that promise.
I could agree more. Kind of validate some of the research that we've done. Many organizations during the pandemic actually accelerated digital strategies. And as we're seeing now, there is a transition or an emerging transition to hybrid care models, and also an opportunity, as you pointed out, leveraging or identifying clinical and technological innovation. But it's happening at a slower pace now the pandemic is waned off. And many organizations are seeing benefits, including reduced cost, enhanced care delivery and outcomes, and increased satisfaction. But I think we're kind of a work in progress.
Yeah, I mean, I can tell you for years when I was able to call a patient at home and say, hey, you have an appointment this week, but I looked at your test results, things are improving. If you're doing fine, I'm still happy to see you. But if you'd like, I'll save you taking you off work, parking hassles coming in. I think they're all opportunities for us when it was just the telephone world. And now with technology that we're evolving to, it really expands those opportunities.
Are you like the Dr. Marcus Welb MD? We go to patients' homes?
Do you know how many people listening to this podcast will even understand that analogy?
Probably not. Yeah, you're right.
But no, I think, leveraging all these different areas and making sure that the way we deliver care is aligned with what the needs are. And again, we went back to that, you're coming to the office to see me, whether you have a bee sting or whether we're treating you for cancer. And, I don't think we need to have that one size fits all philosophy.
Kind of leads into our next question about the challenges encountered in operationalizing your digital engagement programs, and how do you overcome those obstacles? I think the change management seems fairly significant, in getting everybody in the right mindset on the care team.
And there is, and it's probably more so on the care team side than on the patient side. They are much more adaptable. Whenever I look at any of these things, it really is people, process, and technology is third. So getting everyone comfortable with these kind of treatment paradigms, figuring out how we can deliver that. What is the processes? Where are the compromises? How do you mitigate risk there? And then taking technology and saying, given that paradigm, what can we do to support it in a way that makes it efficient and reduces burden? For better or for worse, one of the things that you have to look at is how does it get paid for? And as I said, during the pandemic, they liberalized a lot of those reimbursement models, so people really embraced it. If that changes back, that's going to put a significant impediment to all these delivery mechanisms. Another issue that we have to deal with is health literacy in general, multiple languages, and tech literacy, being able to utilize, having patients and clinicians be able to utilize all these tools in a way that's effective, and they're delivering care that the patient gets what they need, and the clinician trusts that the way they're delivering it is safe and effective. And the last point I will add, and we touched on this before, is that tequity or that technologic inequity, where that last mile can be difficult for people. People can't afford to have the tools at home. How well does a virtual visit work on a phone versus a computer? What are people comfortable with? So, I think all those things are challenges and barriers, but I don't think any of them are insurmountable.
No, I totally agree with you. Let's shift gears. Let's talk a little bit about clinician and patient adoption in particular. Are clinicians embracing hybrid care models, and are they integrating the digital tools within their clinical workflows? And are patients widely adopting these tools across demographics and socioeconomic levels?
Yeah, so clinicians are incredibly overburdened. Many clinicians have left or retired from practice through COVID. Many are burned out from COVID and just from all the administrative burden that is put on physicians today. So when they start talking about new technology and embracing those, it's a real uphill battle. You really have to be delivering something that obviously to them reduces their burden, improves the care they deliver, and hopefully gets them home a little earlier each day. So whenever we look at rolling out new technology, that change management is a critical part of the role of informatics and in the way we deliver technology across the board to people in healthcare. So those are real challenges that I think we can mitigate, but again, we need to develop something that reduces the burden, obviously, at that point. When you walk into an operating room and give a surgeon a new tool that immediately takes less time, is easier than doing it by hand, that adoption occurs very quickly. When we come and say, hey, all you need to do is leave your main EMR that you're using and go to use this new tool, you've already put a huge barrier there. And then invariably, there's things about that new workflow that they're not going to like. And it's just human nature. We focus on the negative, and it makes that adoption much harder. So I think that's a huge opportunity for us as we develop these tools, especially with the opportunities around artificial augmented intelligence to deliver something that's less burden. On the patient side, I think it's actually a lot easier. Patients have been much quicker to adopt new technology, especially our younger patients. Although our seniors also, that we're taking really consumer technology that they have become comfortable with, and we're adapting it to use in healthcare. So there's not that much difference between a virtual visit to a FaceTime call for a patient. Obviously, the clinician has a very different experience, but I think one of the key things to ask is, as we're talking about adoption for the clinicians and for the patients, what are the outcomes? Are we delivering an equivalent quality of care? Are we delivering an equivalent or better care with reduced burden to the physician, with reduced burden to the patient? How do we put that all together, and how do we measure the outcomes? There are some really numeric outcomes that are easy to look at, but clinical outcomes vary so much across the board that it's hard to say using this particular mechanism to deliver care is better, because it depends. It depends on the clinician doing it. It depends on the patient and the patient's situation, both medical and social. So all those things have to be taken into account. So I think we need to offer a smorgasbord of things to both clinicians and patients and figure out what really works. And again, we always come back to that, social determinants of health and that last mile problem of, this might be great for a large number of the patients, but for those who are really are impacted by social determinants of health, are we making it harder for them? Are we making it more challenging for them? And maybe coming into the office is actually easier, but we really have to figure that out as we adapt and adopt these new technologies.
I couldn't agree more. Kind of follow some of the research that we've done, especially when I go on my dog walks with in the Stanford Health area. I get to talk to lots of docs, and they are gradually integrating the digital tools in their workflows. Unfortunately, many of them also express concerns, even though they're digital natives, that they're not adequately compensated for the additional time and effort required to use these tools. And as a result, many clinicians encourage their patients to come into the office. So in trying to get your video to align or be able to get the appropriate vital signs, every additional minute counts against your productivity goals that they're being measured on by health systems in the area. On the patient side, I also agree with you. I think the younger technology savvy patients are totally embracing these technologies and actually would like to see it start to accelerate. Older populations, kind of a mixed bag. They tend to be less interested due to technological accessibility or health literacy issues. And I can only look at my mother-in-law as a good example. She's 85. She just recently had a stroke. loves her smartphone and text messaging, but has zero interest in logging into her Epic MyChart app after multiple rounds of prodding. I've even offered to set it up. Her eyes glaze over, and she'd just rather get back to texting and sending out pictures.
Well, again, it's and my chart portal is fantastic. A lot of the EMRs have portals, but they're very monotonous. You sign in, you go look for something. I mean, if I just got discharged from the hospital and I would open up something, if it was artificially intelligent, it would know. What do I most need? You went home 2 days ago. What are the things I really need to know? I need access to the discharge summary, my instructions, my medications. As opposed to just having that same experience and going to look for something. If we could figure out what is most likely that people need, I think we could probably get much higher adoption of either the portal or maybe another tool that's associated with the portal that kind of is, your shepherd. You're being led through all of this. Your intelligent assistant that knows what you need, and you can interact with it verbally, and it can go find information for you. Once we can get that working well enough and safe enough, I think we'll get much higher adoption from people who aren't the ones who really want to go download 100 apps. They just want answers. They want something simple that's going to deliver them what they need. And I think we're poised to be able to start doing that.
I had surgery in August. I got a 50-page discharge summary that was totally incomprehensible.
Yep.
To the point where I just threw it out, right? There was nothing in there. And I was looking for all the patient engagement, patient education videos, and there was nothing. I had to go on YouTube to get that information, which was quite good. But I spoke to a lot of vendors who actually indicated that this specific health system actually have enterprise licenses for all their videos. And when I asked the care team where they go, we don't have time to look for these things, so we didn't give it to you. So anyway.
But you as a patient, again, with a system that is smart enough to know that you had a particular surgical procedure.
Yes.
You know what surgical procedure you had, when you were discharged.
Yeah.
It shouldn't be hard to figure out the things that you might be interested in talking about.
In theory, yes, 100%.
In theory.
All right, let's pivot. Do digital engagement solutions provide a compelling hard dollar ROI? Is the ROI calculation fixed, or will it evolve over time? Should we be considering softer metrics to justify newer incremental investments like improvements in patient experience and satisfaction? From a CMIO perspective, how do you look at this?
So, the organization I am in is incredibly mission driven. We do a lot of indigent care. We have a lot of people in impacted communities, but you still come back to that no margin, no mission. You still need to obtain the revenue in order to keep delivering the care. So as you're working on patient engagement, as a good example, if we're being paid, and as the reimbursement model in the US is for sick care, you get paid for doing something to someone who is sick. Anything you do that prevents illness negatively impacts your income. Still the right thing to do, but how much money do you invest in things that are going to essentially reduce your revenue? Back in the 90s, when I started practice, value-based care was going to be here in 5 or 10 years. Well, here we are in the 2020s, and we're still saying exactly the same thing. Once value-based care really gets there, and again, I worked for years and years for Kaiser, and in that situation, it was beautiful. It made perfect sense to be able to deliver these things because we actually saw a hard dollar ROI by keeping people healthier, keeping people out of the clinic, out of the hospital. You were incentivized to do all of these things. When you're in a fee-for-service world where you're getting paid for providing care, for doing surgery, it makes it harder to invest in these things, regardless of how right thing it is. So I think there's a hard dollar ROI that we need to work through, and we need to accept the fact that some of the things we do are going to improve the health of our community and may have some negative impact, but have also potential positive impacts. Closing care gaps, we get compensated for closing care gaps. They're all procedures and things that are revenue generating. But looking at it overall, we need to get to a value-based environment, however that evolves, where health outcomes need to be the driver, not how many dollars came in this month. But they're hard to identify. They're hard to measure specifically related to things that we do, but I still think it's the right thing to do. You talk about patient satisfaction, and for that matter, clinician satisfaction. So they may not be hard dollar, but they are hard data. And those are things that we definitely look at: patient satisfaction, and then not just the experience with the provider, but everything from coming to the hospital, coming to the office, the convenience of parking, how much did you get charged for whatever. Those are all factors. And on the physician side, how easy are we making the environment for them to practice? How much burden can we reduce? Physicians went into medicine because they love to practice medicine, and that's talking to patients, performing procedures, seeing the outcomes of their work and a positive impact on a patient's health, thinking about spending significant time thinking and discussing how we're going to take care of people. Those we went into the practice of medicine for, and we need to do those things to bring back the joy of medicine, as opposed to the administrative jobs and other things. But we need to look at all of that, and how does technology provide the best environment for satisfaction. Those are really important things, and we need to look at if we want to keep our patients coming back and to keep our clinicians working.
I agree with you, Howard. Howard, which emerging digital technologies are you most excited about over the next 12 to 18 months that could provide some kind of impact on cost, quality, or outcomes? Are there any specific things that you're excited?
There's a lot of things. First, I'll call out something that maybe isn't really new, but in 2020, the 21st Century Cures Act started mandating us releasing information, results to patients, all of the notes that we document on them, all of their medical information. And kudos to the Office of the National Coordinator of Healthcare IT. This was huge, and it wasn't easy, and a lot of clinicians were very scared about it. But I think it has had huge benefits to patients across the board, and all the technology to enable that is also, all of this data is also fodder for things like artificial intelligence or augmented intelligence. So that's kind of the next one. I just came back from HIMSS, and every company now has something AI. It used to be just intelligent, or it used to be just a good tool, but now it's artificially intelligent, for whatever that means. But I think there are some real significant things around the generative AI piece, ambient transcription, where you can actually listen to a conversation and AI can actually generate a note. Getting that to a point where it's really usable, and that and maybe having different notes that might work for a surgeon, a primary care doc, or the coders, and having different levels of all that information brought together is an opportunity. And using AI to be able to look at data, summarize for the various clinicians what they're looking for, delivering it to them quicker, filtering out the things that they don't need and delivering what they do need. I think those are all really interesting opportunities. The EMR has all of this data in it, but it is so onerous to go looking in all the different nooks and crannies to find things, whether they were done in your organization, whether they came in from the outside through claims or through information exchange from another provider. They're all by requirement in different areas, but as a clinician, why can't you bring that all to me? I think those are real opportunities. The other side, we talked about, wearables and remote patient monitoring and collaboration with clinicians. I think we're at a time when we can really develop middleware that can analyze and summarize all that information the patient provides, aligned with the information that the healthcare organization has obtained from providing care for this person for whatever period of time, and actually bringing that all together in a way that the patients can utilize and the clinician can utilize. If you're a diabetic and you bring to your doctor an Excel spreadsheet of all your blood sugars for the last 3 years, not really helpful. That we don't have any way of really dealing with that. But if systems could take medication changes, your actual lab measurements, admissions to the hospital, other diseases, put all of that in context and help us guide how to take care of someone, and most importantly, giving people the tools so they can help take care of themselves, because then not, 99% of the time you're not in the presence of a clinician. I think those are opportunities really to improve the health of individuals and thus improve the health of the entire population. So I think there's a lot of really interesting things that are coming out. There's a lot of scariness there. There's a lot of errors that get generated and a lot of hallucinations. We've all seen those. So we really have to be careful. As informaticists, we spend most of our careers trying to get clinicians to use technology. And this is the first time I can remember where we probably have to leapfrog over our clinicians and say, wait a minute, yes, it looks really good. Yes, it's really cool. But there's also a fair amount of risk here that we really need to mitigate before we just let this go into the wild. I just know so many physicians who are using things like ChatGPT to help guide care, because it does a really, really good job the vast majority of the time, but except when it doesn't. So we just have to be careful with it. Great potential.
I agree with that. I saw the same thing at HIMSS, and conversations we've had with healthcare providers nationwide indicates even in a time of reduced IT budgets that there is still investments that are planned for 24, 25 in digital health tools and these more intelligent technologies like augmented intelligence. So I'm pretty excited, especially around ChatGPT, but I realize there's some skepticism.
Well, I mean, we attended a great presentation from Jonathan Chen at Stanford, and he showed the ChatGPT coming up with some really good information, but there was enough errors in it to make you question it, and then create references. He asked for references for the data, and it provided references, but they were all fictitious. They didn't actually deliver. They, because of the way it works, just looking at what you have and recommending the next set of words. It's fiction. So
I have seen those URLs, and they're very creative. They look real.
Yep.
Until you hit them. Yeah.
Yep.
All right, let's shift now. Let's talk about healthcare disparities. What role does digital engagement play in reducing healthcare disparities, and how can existing digital solutions address the medical needs of underserved populations?
Yeah. So many of the previous points we've made about patient engagement and patient empowerment really filter in here. Add that to the clinician shortage and the cost of healthcare. We need to figure out how to use this technology to reduce the cost of healthcare and improve the health. And if you look at studies, and there've been a bunch of them done, and they've talked about what causes someone to have a medical problem, and there's genetic predispositions, there's behavior patterns, which is a huge part of it. There's social circumstances and environmental pieces, and then there's healthcare. And the healthcare has a pretty small component of it. We're probably in the 10% range, but yeah, and we can't do anything about your genes. You're stuck with them, and you can blame your parents. But those behaviors and the social circumstances are very closely tied together. You may not want to do something, but because of the environment you're in, you may not have a whole lot of choices. So if we can use technology to help improve patients' behaviors, and particularly risky behaviors and behaviors that negatively impact their health, we can do a lot to improve their health, which hopefully can improve their social circumstances, which reduces their environmental exposures and turns around and improves their potential behavior. So I think it's a virtuous cycle that we can actually kick off if we can get to the point where technology can help people make changes. So empowering people to support better behaviors can mitigate those social determinants. And if we can figure out how to mitigate the social determinants, we can then improve patients' behaviors. So I think there's a lot here that can be done. One of the problems is who pays for it. All of these things are wonderful things for society, but they're also consumer and industry created solutions that need to get paid for. And healthcare organizations, by their revenue model, these things are not the things that really that they would be incentivized to invest in. So I think the revenue model,
that actually across the country right now, we pay lip service to it. And the great thing about the smartphone is that it's so accessible across demographics and socioeconomic levels. It seems like almost everybody has a smartphone. They even have this thing called Obama phone that they're giving free phones out to for text messaging. So I think there's a lot we can leverage from global health and addressing communities in our backyard.
For sure. When I was at Alameda Health System, where we had a large number of impacted patients and the poor, everyone had a smartphone. It was their lifeline. It was how they did things. They might not have had a home. They might not have had a place to had food to eat, but that was their lifeline. So I think we can leverage that. And, if they're well done, I think applications, especially in collaboration with healthcare organizations, can really help. How do we keep those costs down? I think it's an opportunity. Developing these tools is getting less and less expensive, and AI is making them more and more available and dropping down those barriers relative to language translation, relative to understanding how to ask a question and get an answer. So I think those are all opportunities that we need to dive in on and really invest in.
Awesome. Hey, Howard, thank you for sharing your insights today. Our discussion kind of closely aligns with the results from Spyglass's latest study on digital patient engagement that was published last year. For those of you who are not aware of Spyglass is a market advisory firm focused on disruptive technologies, changing business models and growth opportunities within the healthcare and life sciences industries. We have more than 250 satisfied customers who are top-tier technology companies, management consulting firms, and healthcare provider organizations. We've published more than 30 market research reports on a diverse set of topics, including clinical communications and collaboration, digital patient engagement, telehealth and remote monitoring, and clinical surveillance. To explore our extensive library of paid research and gain deeper insights into how technology is reshaping healthcare, I encourage you to go to my website at www.spyglass-consulting.com. Well, Howard, thanks again for sharing your insights and perspectives. And thanks to our sponsors, Storage Systems and Simplify Medical, who made this conversation possible. I think during our conversation today, Howard, you made it clear that the integration of digital tools is a vital evolutionary step toward more efficient patient-centered care. You also shed great light on the transformative power of digital engagement strategies and how they can directly impact healthcare quality and outcomes, and the critical role that clinicians can play in embracing these technologies. Howard, do you have any closing remarks that you'd like to make for our audience?
I think just underlining the potential. AI is not going to replace physicians. AI is not going to replace the care we provide, but I think it is a huge enablement to better provide care for our patients and provide a better experience for our clinicians. And I'd encourage our clinicians to really move forward and embrace it. I know it's new. I know it's scary. I know it's concerning, but I think it is a real path forward. And I know that they've heard it before because I've been hawking, electronic health records and these kind of things for 30 years. But I think we are at a real inflection point in the use of technology to provide care for our patients.
Awesome. Lars and Keith, do you have any final thoughts on today's webinar?
I mean, not really. I liked the term techuity or technical inequity. I need to work on the enunciation of that. And then, it was an interesting point that Howard made on, the alternative side of value-based care. As a has-been athlete, I've been under the knife for a couple knee, a couple shoulder surgeries, and surgeons want to do surgery. So I understand that part of healthcare, and hope that we can continue to go more in the value-based route. So, no, great call. Appreciate everything, Howard.
So yes, thanks, Greg, for your passion in this topic and your ability to facilitate. I really enjoyed the discussion, and I want to thank Storage Systems, our co-sponsor, but I guess I really want to thank Howard for his perspective, for his leadership. He's got so much seasoned the experience, you can tell from being a CMIO, and I thought it was really encouraging, the positive attitude that he has about the potential that these obstacles are opportunities, and there's a lot of them out there, but really just healthcare is a grind. And everybody, I think, realizes that. But in this particular case, I found it was really positive, uplifting, and I hope, Howard, you'll come back and join us for another episode.
Happy to. So it's a pleasure.
And before we conclude today's webinar, I want to gather some feedback from our audience members with a couple of polling questions. If you could kindly respond in the comments section below this video. On a scale of 1 to 5, how would you evaluate the effectiveness of your organization's patient engagement efforts, with 5 being the highest? And the second question, how would you assess your organization's commitment to investing in digital tools and technologies to support patient engagement, also on a scale of 1 to 5? Well, at Beyond the Blueprint, we look forward to continuing our conversation with you in future episodes of this series. And Howard, you're always invited back to share with us yet another story about the land of informatics, because your insights are always truly enlightening. Thank you.
Been a pleasure. Thank you all.